Everyone. My name is Stephen Lazarou. I am a reproductive urologist. Just as a brief overview, approximately 15%, which is 1 in 6 couples, are unable to conceive after 1 year of unprotected intercourse. A male factor is responsible in about 20% of infertile couples and contributory in up to 40%. So it really represents a large portion of couples struggling with fertility. Generally, male infertility is determined by the finding of an abnormal semen analysis, although other factors may play a role in the setting, even if there is a normal semen analysis. Male fertility difficulties can be due to a variety of conditions. Some of these conditions are potentially reversible, such as obstruction of the vas deferens or hormonal imbalances. Other conditions are not reversible, such as when there's injury of the testicles or what we call atrophy of the testicles, secondary to a viral infection or trauma. Just a little bit more about when to evaluate the male. A couple attempting to conceive should have an evaluation for infertility if pregnancy does not occur generally within 1 year of regular unprotected intercourse. An evaluation should be done before 1 year, however, if there are known male infertility risk factors, such as a history of what we call undescended testes, where the testes don't fully progress down into the scrotum, or if there's a history of chemotherapy, there's been cancer or radiation. And then there may be other reasons, including female infertility risk factors, such as advancing maternal age, or a couple that questions the male partner's fertility potential for a variety of reasons. So furthermore, while a man may have had a history of a previous involvement in a pregnancy, this doesn't exclude the possibility of a newly acquired, or what we call secondary factor, preventing normal fertility at this time. So men with secondary infertility should also be evaluated in the same comprehensive way as men who may never have initiated pregnancy. So a comprehensive evaluation of the male partner by a reproductive urologist really allows the couple to better understand the basis of their infertility and to obtain genetic counseling where necessary. So identifying certain genetic causes of male fertility allows these couples to be informed about the potential to transmit these conditions, and that might affect the health of their offspring. So male fertility, or infertility, I should say, may be the presenting sign occasionally of an underlying life-threatening condition, such as a testicular tumor or pituitary tumor. We do find that. So the evaluation of the infertile male should be performed by a urologist, typically a reproductive urologist, and include a complete reproductive and medical history, physical examination, and at least 2 semen analysis, because semen analysis can vary considerably. The reproductive and medical history should include looking at the frequency and timing of the intercourse, the duration of the infertility, prior fertility, a review of childhood illnesses and developmental history, any medications, any systemic medical illnesses, diabetes, upper respiratory diseases, let's say recent COVID exposure or other infections, and prior surgery, such as hernia repair or other testicular surgery, as well as an evaluation of the sexual history, including any history of sexually transmitted infections or exposures to toxins like heat exposure, chemical exposure, radiation, and including smoking, drug use. And then in addition, the family reproductive history is also very important because oftentimes it can be passed on from one generation to another. A general physical exam is really an essential part of the evaluation. And in addition to sort of the head to toe evaluation, particular attention is made to the genital area, looking at the penis, making sure that the opening of the urethral meatus is normal in terms of size and location, looking for any plaques or lesion to ensure there's no curvature or corones, and then a careful assessment of the testicles to look at the general size, the shape, consistency, and then looking at the ductal structures, looking at the vas deferens, which allow the transport of sperm, the epididymis, which is important for the maturation and processing and storage of sperm, and then looking for enlarged veins in the scrotum, what we call varicoceles, which are very similar in terms of the varicose veins that a lot of men and women have in their legs. And then looking at secondary sex characteristics, looking at the body shape, distribution of hair, whether or not there's any enlargement of breast tissue, and where appropriate, a prostate exam or rectal exam. So based on the results of this evaluation, urologists often will recommend other tests and or procedures to determine the cause of a patient's infertility. And these additional tests may include additional semen analysis, hormonal evaluation, ultrasound, such as doing an ultrasound of the scrotum to evaluate the testicles and the surrounding structures. Where appropriate, sometimes we'll do an ultrasound of the prostate and the seminal vesicles to look to see if there's any blockages or swelling or cysts that might suggest potentially correctable factor. And then certain specialized tests, DNA tests, and other genetic screening. So treatment of various conditions may improve male fertility and allow for conception through intercourse. Even men, fortunately, who have absent sperm in their semen analysis may have some sperm production by their testicles. Overall, if corrective treatment is not available, we have assisted reproductive techniques such as testicular or epididymal sperm retrieval in combination with in vitro fertilization, which is IVF, and or intracytoplasmic sperm injection, ICSI, where the sperm is actually physically penetrated into the egg. And these can be utilized. And of course, couples do have the option for donor insemination or adoption. You know, what's good for your health is good for your sperm because we're one organism. So we always try to encourage a healthy diet and lifestyle, a healthy body weight and exercise. This helps the mind and the body. And avoiding negative habits such as smoking and avoiding testosterone products because regrettably about a third of men of reproductive age have been taking or prescribed testosterone products without the understanding or full knowledge of the consequence of negative impact on sperm production. You know, I'm in favor of men taking multivitamins. I think that, you know, the data on multivitamins is a bit back and forth. It's not entirely clear, but we know that generally these nutraceuticals are safe, and the rationale is that they reduce inflammation in the semen. They function primarily as antioxidants, vitamin C, vitamin D, zinc, selenium, and oftentimes we'll add in coenzyme Q10. So I think they're generally safe, and I think that they may be beneficial. So I personally have a low threshold to recommending it. Obviously, a lot of men are pursuing a healthy diet and lifestyle, but I think it's worthwhile. Please feel free to reach out anytime, and myself, my team, will get back to you as soon as we can. Our website is bostonurology.com. Easy to find, easy to reach. So I wish you all the very best in your fertility journey and have a great night. Thank you.